Mental health professionals of Reddit, what is the most disturbing case you have personally encountered? Part 1. I've had too many to count, but the one family that I always think about was one I worked with 7 years ago, when I first started my career. Dad was quadriplegic and confined to his hospital bed in the home. He spoke English fairly well and another language from where the country he was born in. I don't want to give away too many distinguishing facts, and Mom was straight out of an Asian country, and did not speak any English in her native language, which was not Dad's. This means they could barely communicate. The story of how they met was also confusing, but we think it was a marriage that was either like a mail order bride situation or they got married for her green card. Either way, the situation was bizarre as they had 3 children. One was 5 and then the boys were twins and they were all speech delayed as they did not have one native language in the home, and the boys had some cognitive disorder, where they had issues with expressive and receptive language. They were extremely dysregulated and were constantly doing things like pulling pots of boiling water off the stove or climbing onto high furniture and getting injured to the point that DCF had this case for a while. Because there was no effective way to communicate with them, they were very difficult to redirect or set limits with. Mom was also the sole caretaker of all 3 children and Dad who needed a feeding tube and round-the-clock nursing care. This poor woman, and to top it all off, she may have been cognitively delayed herself and was barely holding it together. So here's the strange part. Dad was a quadriplegic and in the middle of a lawsuit with a nearby city, as he said he was a victim of police brutality and he was hit by a baton which caused him to slowly have some type of spinal injury, where he could no longer use his legs and arms. We were working with the kids in the home at the time, so we would see him in his bed laying down, when we were over, and wouldn't even be able to nod or move his head, much less hold a pen or walk. As time went on, we realized that the documents we dropped off were being signed in English and written nicely, which if you remember, Mom couldn't speak English much less write it. We also noticed that his bedpan was used for storage and never used, which is strange if he couldn't go use the bathroom. There were just little things that added up that we suspected he was malingering, but it wasn't really our business as our main concern was the kids. One time, the girl said something in broken English that sounded similar to Mom and Dad whipped me, so we told Dad that we had to make a report to DCF. They honestly needed the help anyways, since it was too much for Mom to handle. When we went in to tell Dad this happened, he flew off the handle and bolted upright in his bed and started yelling and waving his arms around and flailing about. We left and told our supervisor about the situation and never went back into the home. 40-year-old male seemingly gave up on life. Quit his job, became homeless, and started sleeping about 20 hours a day. Family insisted he seek help. Turns out, he got really good at lucid dreaming and found his dream world better than the real world. Would wake up to do basic life things like eat and go to the bathroom, then live 1,000 years as a king in his dreams. He was perfectly sane, and it made me question everything. I am not a mental health professional, just an old paramedic. Saddest I saw, was a very healthy, and reportedly well-adjusted 22-year female. She was a bridesmaid at a wedding. She was attending with her boyfriend. She kissed another guy, why? And suddenly had some kind of break with reality. She just started talking about really random things and was unable to really carry on a conversation. Her boyfriend brought her to the emergency room thinking stroke or diabetes. After being evaluated medically and finding nothing, the mental health counselor on call was brought in. He believed she had developed schizophrenia and had suddenly manifested itself. He stated her family is facing a very long and difficult road with her. She'll need very long-term treatment. It was incredibly sad to see this young woman with such promise to be dealt this hand. Male, 35 years old with severe bipolar disorder. When he was in a maniac state, he would stop taking all his medications and consume about 15,000 calories per day, leading to astronomical levels of fat in his blood. At 35, he was in heart failure after 3 myocardial infarctions and his pancreas was toast after 20 episodes of pancreatitis. When I talked to him he was in a neutral state and told me he was trying so hard, but there was nothing he could do. When the maniac state came, he felt like the king of the world that had no use for medications and could eat everything. I work with severe trauma cases, so I've seen it all. I have a client who is intellectually disabled and when he was a kid, his mother would chain him to a tree out back and let people come over and pay her to do whatever they wanted to him. Department of Families and Children found him malnourished, bleeding from the anus with a traumatic brain injury from the abuse. Because of his injury, he really does not remember the abuse. He still calls his mother and speaks nicely of her. Russian orphan, adopted by an American mother. Kid was not physically touched or held for the first 6 months of his life. He grew up totally fucked up because of this. Molested his sister, screamed at his mother on the regular. Dad was not in the picture, total bully and menace at school. He was like 17 when he came in for services at my agency. Not exactly mental health, but a paramedic. I saw some pretty rough stuff like suicides etc., and most of the time, we get there fast enough to talk them out. Once, we got called to a case of a person threatening to kill himself by train. There was an immediate shutdown of the rail requested, but he refused to step off the tracks. As he asked to see his wife and kids, they got here pretty fast. He hugged his children on the tracks, pulled a gun, and ended it. Those kids probably will stay traumatized forever. There was a patient at an inpatient psychiatric facility for suicidal ideation. She constantly insisted that she had a mass on her breasts and demanded to be physically examined, only by male doctors. When the psychiatrist I was rotating under declined to perform a physical exam, she asked me to do it during my daily patient interview. I also declined physical exam, but had a bit of a hunch to check her medical records. It turned out she had an ultrasound done a week before that found only normal breast tissue without masses. However, apparently this lady had frequented many doctors' offices with various complaints of an unspecific nature and would usually focus on breasts or vaginal complaints when she visited male physicians' offices. We diagnosed her with factitious disorder, formerly known as Munchausen syndrome, and histrionic personality disorder. It seems her goal was mostly attention from medical professionals. She had lots of issues, but we also had to be careful to make sure she wasn't fishing for a lawsuit. Patients like her are why doctors document everything meticulously, so the patient wouldn't admit to making things up all the time. According to the psychiatrist I was working with, she didn't actually believe any of her health problems exist and her primary goal was the attention from medical professionals. If she actually believed she was sick, we would have diagnosed her with illness anxiety disorder, commonly known as hypochondria or somatic symptom disorder, depending on whether her symptoms were real but her reaction was out of proportion to them. Not a mental health professional, but I lived with a lot of mentally ill people for like a month when CPS took me away from my parents. This might not be as bad as some of the stories here, but I still get mad whenever I think about it. I had a roommate who was 11 and had been there for a few months already. She was really kind and very mature for her age. We got kinda close and she told me that her mother used to leave her alone for days and she never knew if or when she would come back. She got so desperate, she resorted to self-harm to get her mother to care, and she ended up slicing her wrists and putting ink in the wounds, hoping that her mother would care if she was about to die. But her mom didn't care, didn't even come back and notice it. She had to ask her neighbors for help so she wouldn't die. Poor girl never got visits or calls either. I'm genuinely wondering if she's better now, but they didn't let us keep in touch. Patient was born addicted on methamphetamine and taken home to a house, which it was also produced for profit. After growing up and later becoming addicted, the patient basically had no social skills or short-term memory due to chronic meth affliction. Scans looked a lot like several traumatic brain injuries. Because they were so developmentally behind, they were in and out of jail, and when they were released back into the public, they would end up in a psych crisis hold. Patient was incredibly violent due to lacking emotional regulation, frequently had auditory and visual hallucinations, didn't know how to eat or bathe properly, couldn't speak an identifiable language and couldn't otherwise communicate or understand needs, etc. It was a very sad case file to read through. Early years of nursing. Double above the knees amputation. Boyfriend was attentive and caring up till the day he took everything she had and disappeared. Second case was a closed head injury, who could only lay in bed and say over and over, "Don't hit me, don't hurt me," and her significant other, who was suspected by the family of putting her in the hospital, would come to her room every day. I have a friend who contacts me regularly, late at night, from his healthcare position. He has the unenviable task of being a live-in nurse for a house of 4 mental patients. There are no locks on the doors, and all 4 of the men he has to stay with and care for have previously presented extremely violent tendencies. Last time he contacted me, he told me that one of the men had tried to commit suicide by jumping out of a window, only to break his leg, and then at 5 o'clock the next morning, one of the others tried to stab him with a broken spoon. I don't know if any amount of money could make me want to do that job. Imagine the constant stress. Currently working as a caretaker in a daycare facility for adults with mental disabilities and on the far end of the autistic spectrum. We have a patient that strictly speaking shouldn't be with us. I don't know exactly what kind of pathology he has, but he's more on the mentally ill side rather than mentally disabled. But he's basically a refugee from the psych ward, where he was being abused, so we took him anyway. Potentially, the most dangerous of all our patients. He demolished the cafeteria all by himself, a couple of weeks before I started working there. On my first day, I was given 2 instructions: always be very firm with him, don't let him get away with anything, and never let him laugh. If he starts to laugh, you'll never make him stop, and that's when the crisis starts. Another patient was bullied when he was little. Kids on his block made him run after food. Not really disturbing, but of all the things I've seen so far, and I'm fairly new, that one hurt me the most. A family dropped their child, put him in a crib for 3 days. Took him to the ED and said he fell. By then, he had acute hydroencephalopathy, and required immediate neurosurgery. He will be paralyzed on his left side for his entire life, limping along and barely able to take care of himself. Worked on placement as a student within the Young People's Intensive Community Treatment Team. Was working on triage and got a referral from the local accident and emergency department. A young child, aged 8, had been admitted following a severe overdose, for which she needed treatment for. We were asked to liaise with the police as they found evidence of sexual assault. Was heartbreaking to have to assess her. Worked with a youth, whose parents would chain him in the basement for days on end, and let bugs crawl on him, while they did drugs. There's a ton more to the story, and it was absolutely insane. The youth's IQ was at genius levels from what I recall. My AP psychology teacher in high school told our class how a professor of hers had recommended that a patient be released, as he considered the patient to no longer be dangerous. Upon release, the patient immediately went to his ex-wife's home and murdered her. Her professor felt no concern over the matter. Had a minor who had a history of extreme physical abuse that led the patient to develop a second personality. That personality would tell them to hurt themselves. Patient had auditory and visual hallucinations and reported seeing rain of blood. The patient never exhibited any expressions, no smile, no anger, no noticeable sadness, just a neutral expression. I worked with teenage girls with sometimes severe emotional and behavioral problems. We had a girl, 16 or 17, who had problems with rage and violence, hallucinations, etc. Can't entirely recall her background, but I believe she was in the foster care system. Her bottom front 6 teeth were missing because she pulled them out herself. One time she got a chapstick tube, emptied it, and used it to pry out her tooth. Then she handed the bloody tooth to a staff member nonchalantly. One time she got in an argument with staff at bedtime. She attacked and had to be physically restrained. She was strong and they couldn't really move her. She screamed, "They're raping me," for hours, which wasn't very nice for the other kids, many of whom had been molested or raped. Hours later, they finally managed to get her out. She really did scare me. Kids kept bullying her in school and she would beat them up pretty badly. Obviously, I don't condone violence, but she beat so many kids up and they continued to bully her. One time, she was pulled from school for misbehavior and I happened to be walking by and she gave me the scariest death stare and started running toward me to attack. Luckily, the staff she was with intervened. This was like 10 years ago. My guess is she's in prison. Person, who I did an assessment with, who started the assessment completely normally. I thought a little depression here, some anxiety there, until we got halfway through the assessment. They started claiming they were being followed by their family, hitmen were being sent after them, they kept having to change their name and change their hotel location because of the people their parents sent after them, who put trackers in their car and under their skin, and just the completely believable way they were describing the situation. That made me really question what was real and if they were a schizophrenic or if it could literally be happening to them. I don't like being dragged into the crazy with my clients, but I came out of all our sessions questioning reality. I had a few cases. I performed home visits to chronically ill and elderly patients. I've seen a lot of disturbing things. 2 that stuck out the most to me. The first one. A patient, male 60, stroke survivor, living with his mother, 90, very fit and active. Apparently, he had gotten rid of all of the doors in the home. Pointed this out as odd. I then received word, maybe a week later, that he was kicked out of home. His mother claimed that he tried to rape her and there are no doors, so that he can get to her more easily. He would ask his mother in the past to help him pleasure himself because he couldn't do it due to the stroke. I had never experienced that. She did not want him to permanently leave the home. So we placed him in adult daycare. The second one. A 90 female patient, suffering from delusions caused by UTI, from what I can recall. She was severely dehydrated. I was the only one to see an issue with this. I raised concern with nurses, but they shrugged it off. The stepson reported elder abuse, but was never believed. When I met the grandson at the home, I felt sick. I felt her fear. I'm very sensitive. I said that I'm not going back. I almost lost my job. Then I found out that the grandson was selling coke from the home, had crazy parties while she was home, and guns everywhere, and he would threaten to kill her daily. Last one. Provided services telephonically. A woman called and she was freaking out. She recently had plastic surgery of the face. She was screaming that her face was coming off and her doctor wouldn't help. I just didn't know how to respond, which is unlike me. I work exclusively with sex offenders, some of whom are pedophiles by diagnosis. My line of work puts me face to face with some of the worst that humanity has to offer, and part of my job is to listen to detailed descriptions of what happened before, during, and after their offenses. The offenses against infants can be pretty tough to sit and listen to.